Family integrated care, which is also known as FICare, is a model of neonatal care that really recognises and values parents as equal partners alongside the nursing, medical and allied health professional teams. Family integrated care is really important because it encourages parental independence on the neonatal unit and helps to ensure that families form and start to function as a family as soon as possible, despite the potential physical and emotional barriers that can occur with a neonatal admission.
Family integrated care is working in partnership, the staff at the hospital, the community midwives, everybody working together with the family, so the family have their say, they get trained, they look after their baby. Even in a hospital setting, you can have your way with your baby. You know, you can feed them how you want. The nurses will teach you how to do tube feeding, change their nappies when they're in the incubators, which is tricky. Everything is about the family.
There is lots of evidence that supports the benefits families feel from family integrated care, and these include more successful breastfeeding, improved bonding, fewer infections and therefore less antibiotic usage, earlier discharge, reduced readmission rates, and really importantly, enhanced parental confidence at discharge and enhanced brain development.
Alongside the short and long-term benefits for babies and their families, we've also seen real benefits to the staff since we started delivering family integrated care. It's empowered them to teach change within the unit and has contributed to happy, united teams. It has been great to see their confidence in teaching the parents grow.
Caring for your baby on the neonatal unit will likely look a little different to how you would provide care at home. However, this does not mean that you are unable to take the lead in your baby's care. It may be daunting at first, but the neonatal team will be able to support you with this, and many neonatal units have teaching packages available for parents that cover a range of care topics. It is also important for you to learn about your baby's cues and behaviours that can tell you the appropriate time to provide care for your baby.
It was beneficial for me because it just built my confidence, because she was so small and I was so worried about handling her and if I'd do something to hurt her, whereas after a few days of being really involved and being shown how to care for her and the little things I could do, you know, that helpless feeling of seeing her in an incubator and thinking, oh, I feel helpless, I can't be a mum. I got this confidence and I could start giving her care, and in turn it helped my mental health definitely.
Many neonatal units also have parent accommodation or the ability for you to stay with your baby overnight at the bedside, which may make it easier for you to provide care for your baby. You can speak to the neonatal team to find out if this is possible.
We had the accommodation for a little while, which was amazing. Best week
So good.
that we had. Like, obviously the first couple of days was just hard, and then obviously this week we're staying with them and we're having our tea, watching some films, feeding the babies, that kind of thing. It was really lovely.
As well as supporting you with practical elements of caring for your baby, neonatal teams can also support your overall well-being. It's normal to experience a range of emotions during your time on the neonatal unit. How you feel will be individual to you. FICare and being a partner in your baby's care can help balance the many emotions you may experience while your baby's in hospital.
When the nurses are doing the family integrated care, they always ask if you're okay. And it took me a while to say I'm not okay, if you know what I mean.
It often helps to talk about your feelings with a trained professional. Your unit may have a neonatal psychologist who will be able to help.
Sometimes you just want someone to listen to you and say that that's okay, that you feel like that, that's normal. I think that probably is important to know as a mum.
They asked us how we are,
Yeah, or every day. How are you? How was work? Because I was still going to work. They were saying like, how was work? You don't have to do this. Don't worry if you're tired. You know, have you eaten today? Have you had plenty to drink?
Yeah.
You know, like, how are you? They really did care.
I think without the family integrated care, emotionally, we wouldn't be in a place we're in now. I think we'd be in a lot worse place. Just the support we've got from them, it's been fantastic.
If you would like to access support, please speak to a member of the maternity or neonatal team.
Just try and get involved as much as you can. The nurses will support you, and don't be afraid to ask for help, or if you don't know why they're asking you to do a certain thing, definitely ask.
As parents and carers, there are a couple of things you can do to support FICare on the neonatal unit. You can ask the nurse that is supporting you to care for your baby what the unit does to provide FICare, and if there are any teaching packages suitable for you that will enable you to be your baby's primary caregiver.
Just really be hands-on, and it might not feel comfortable at first, but the more you do it, the bonding with your baby will increase.
You could consider sharing your views with the neonatal network or a member of the neonatal team, so we can learn from your experience, and above all, you can spend as much time on the neonatal unit as you can and want to.